last summer, I broke my leg playing soccer.
Oh, no.
And I ended up going to PT to help kind of figure out what exactly had gone wrong. And while this PT was extremely helpful and was able to diagnose and kind of tell me what was wrong, his solution didn't make any sense. So what I did is I thanked him. I threw away all his notes once I got home, and I ended up doing the movements that I know that actually help release my muscle. And within 15 minutes, I had increased my range of motion by like 15-20%.
This podcast represents the opinions of our hosts and guests. The content here should not be taken as medical advice and is for informational purposes only. This podcast also does not establish a standard of care, doctor-patient, or client relationship. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or website. And because each person is so unique, all listeners are encouraged to connect with counseling and medical professionals for assistance with their personal journey. All people, places, and scenarios mentioned in the podcast have been changed to protect the privacy of those involved.
Welcome to We're Not Fine. I'm Dr. Talia Jackson.
And I'm Dr. Jensen. We thank you for listening every week to our deep and thought-provoking conversations about relationships. So for everyone listening, this is part 2 of this podcast on chronic pain with our amazing guest, Rhianna, not Rhianna. I was going to make jokes like I was texting with Rhianna earlier, but it was Rhianna. Little different.
It's hilarious.
Your last name is Gawrys, and you are a certified yoga therapist, a chronic pain sufferer, now specialist, and somatic yoga therapist. I think during part 1 you said Soma Yoga.
Ooh, I liked it.
And it felt like a product, like something I should eat.
I thought it sounded like a neighborhood in San Francisco.
Like a yogurt.
Or Brooklyn.
Opposite sides of this U.S. So welcome back, everybody. And, you know, because I'm not paying attention to the agenda at all, as we know, this is going to be interesting what we cover.
I can't wait to find out where you go with this, Doug.
I bet you can. You kind of go with the flow so beautifully, though.
Oh, thank you.
That's why we do conjoined therapy well with our relationships.
We do.
Yeah.
Hi. Welcome back. Okay, should we just dive into part 2? Why, yes, I think we shall.
Sure.
We touched on a little bit of the trauma and grief piece in part 1, but we wanted to do a little bit more of a deep dive. And so a journey such as yours does tend to include some trauma. And what that might look like, even if everything has been resolved and you're pain-free, footloose and fancy-free, living your best life, is when that trauma creeps back up, it could look like anxiety. When is the other shoe going to drop? Like, I've had a good run, but I remember how dark it was, that horrible, dark, hopeless tunnel. Could that come back at any time? Should I brace myself? Should I straddle? Maybe I'll have a great life. Maybe I'll be miserable. I mean, how does that play out for you?
So all those things are absolutely true, I think, and the reality for most people. For me, that's not a reality, though, because I didn't lose my health because of this. I lost it for a time, but through understanding Soma Yoga and the methodology, I gained something more deep and profound than grief or trauma, which is I gained power and sovereignty over my own health.
Wow.
And it wasn't that I just reclaimed my old health back as a 25-year-old or whatever I was at the time. It was something more meaningful than that. It's that I was able to learn a self-mastery that transcended my original suffering. So I'm going to give an example of what I mean by this. So diagnosed with chronic back pain. So obviously I learned about what to do with my back. And last summer, I broke my leg playing soccer.
Oh, no.
And I ended up going to like a sports doctor, sports injury PT, to help kind of figure out what exactly had gone wrong, and how should I heal from it. And while this PT was extremely helpful and was able to diagnose and kind of tell me what was wrong, his solution didn't make any sense. So I'm just going to do a little bit of context. So what had happened is one of my muscles contracted so tightly in order to prevent a real break at my knee that the contraction, the tightening of the muscle, ended up causing a stress fracture in my bone. So it pulled my bone apart because the muscle was so strong in contraction, leaving me with a lot of, I didn't have a lot of range of motion. I had quite a bit of pain. And so the solution from the PT was, well, this muscle was fatigued from such a huge contraction that it broke bone. You need to strengthen it to get your range of motion mobility back. And I initially thought, okay, well, that doesn't make any sense at all, because why would we have something that's fatigued and add strengthening, which is efforting to it? That doesn't make any sense at all. So what I did is I thanked him. I threw away all his notes once I got home, and I ended up doing the movements that I know that actually help release my muscle. And within 15 minutes, I had increased my range of motion by like 15, 20%. And it just got better as I kept doing that. So what I mean by the fact that I was able to transcend my original suffering is I can take care of any area of my body regarding pain. It's not related just to my back. So, have I had pain since my back pain? Yeah, I have. I've tweaked my back. I've hurt things here. I play soccer and I have tight legs and muscles and such. But I know what to do right away, and I take care of it so quickly. And usually the reason it's happening is because I either overexerted my body, or I haven't been doing my due diligence of, polishing the tarnish off the penny of my body consistently enough. And that's fine. When we're in pain, we spend so much time managing our body and our environment and the relationships that we're in and all the different factors that to have a bit of breath of fresh air and not have to deal with taking care of our body is a huge relief and just freedom. And so I revel in times when I don't take care of my body if I don't want to. But then if I do something wrong and I kind of tweak something, all I have to do is come back to the exact same practices that got me out of back pain. So I can apply it to anything.
That's a very practical response. I'm kind of curious about the emotional part of that.
Yeah. So there's actually something really interesting about this. And if anyone knows about this, or there's someone who's listening in the future who knows about this, I would actually be very curious, because I've not yet heard about, we talk about trauma from, relationships, violence, things like that. Yep. But I've actually never heard anyone talk about pain trauma. Now, I actually don't have any trauma in my body related to my back pain, but I had a separate episode of pain that, maybe I will tell this story, completely not related to my back. There is something that happens with pretty much every client that I work with called stretch reflex. Stretch reflex, now there is something in sports therapy that's called stretch reflex. This is not that. Stretch reflex is when we have pulled a muscle past its safety point. There's a spindle cell in the body of every muscle that essentially tells us how safe is it to lengthen that muscle. If we move it past that safety point, we trigger stretch reflex, which is our body's way of responding by telling us, you have moved past the safety point. I'm going to tell you, and the only way that I can, I'm going to tighten more so you cannot do that again. Now, it just usually progresses as increased tension, maybe decreased range of motion, more pain. But as we move into chronic pain, it becomes more pain, more tension. Then it moves into its next phase, which is spasms, cramping, Charlie's horses. Then it moves to the next iteration, which is throwing your back out. There is one more iteration, which I actually have experienced, which is full stretch reflex. It is horrific. It is 10 out of 10 sharp, horrific pain that is absolutely immobilizing. My family found me, I had stood up at work, and it was in my calves. I stood up at work and I realized I couldn't move, and I had to go home, and my family found me on the ground in tears. And at the time I was not someone who cried much. And I was in agonizing pain for about 48 hours. Nothing helped. Not even the things that I knew how to do were able to help. I was in so much pain. I had to walk on my tippy toes and hold myself up on a chair just to move around if I had to go to the restroom or something. And it is that pain that I have pain trauma from. It's something that doesn't come up very frequently, but it's come up when I have sharp pain. So a couple of times I've tried acupuncture since, and I actually had a panic attack on an acupuncture table with needles in me. And I was luckily enough, I was so shocked that I was able to sort of move into an observer mode, being you are freaking out. There's no reason why. What is happening? And I realized that it was related to this old pain of something that was, not related to back pain at all. And I actually, when I when I broke my leg and I fell, I yelled, but then I had this moment of this old pain come back and I screamed bloody murder on the soccer field. And it was at that moment that everyone was like, oh, she is not okay. And I remember kind of thinking through the process and wondering like, oh, okay. Yeah. Like it had to come out. So now I don't know much about like pain trauma for chronic. I mean, I know it's there. I haven't really, it doesn't come up very frequently when I'm speaking with people. But I have noticed that one in my body, and it's something that I plan to keep paying attention to and seeing if anyone else. I mean, I don't know many people with my story of having come completely so much out of pain that I'm pretty clean for the most part, but yet there is this thing that lingers.
So what's interesting, I think about, and we referenced him in the first episode of this, Bessel van der Kolk talks about phantom pain. So he will talk about pain trauma. Like I think people who have been amputees, for example, from the military, if they hear a loud noise that sounds like the explosion that might have taken their leg, they will feel that pain in their leg, even if it's not there. And talk about that brain connection that you have referenced a few times in part one. It's really quite significant.
It is, and if we kind of back up a little bit and look at this at a really basic level, when we're in our mind and there's, stress of some sort happening, we all are pretty aware that like our shoulders will tense, something will tighten, right? Oh, sure. We're familiar with that. Yep. And, as his titled book, The Body Keeps a Score, this is what's happening. We do internalize the feelings and emotions. And if we're in chronic pain, we definitely are as well. I shared the individual that had been in chronic pain for 30 years and was like on a clamp down. I had a session that was really interesting just this week with a client who has been struggling a little bit. She's been very diligent about doing the movements and has found relief, but like, I just had this intuitive knowing of like, I can't work on the physical layer with you anymore. I need to drop down into some deeper levels with you. So this means for her, their case, mental emotional layer. Yep. And what we ended up doing is different than I typically do in a session where I had this person perfectly, lying down in a position that was comfortable. And I essentially had them go through sensing and feeling the pain and the fear around the pain, metabolizing it, like holding space in their body for it. Because normally we think of things that are uncomfortable and we move away from it. Oh, this is scary. Oh, this is fearful. Oh, this is anxiety. Oh, this is whatever. I'm going to move away from it, especially if we have any sort of more traumatic or triggering emotions towards it. Yep. So I had this person sense and feel the emotions that were coming up and connected. Like what's tightening? What's tensing? What do you feel? What do you sense? What is your mind doing? And as we went through this process, that was metabolized out. And then I moved them into, let's go to a moment where you actually stood up and were out of pain completely, because we've had a couple of these. So now feel that. And as we kind of did this infinity sign, this back and forth of coming in and out of discomfort and accepting like hope and joy and relief, the mental emotional state of the fear ended up, it was there, but she didn't have the same effect. And actually, once we were finished with the session, this person got some great insight from their body that was telling them about what they should do, where the fear was, how could they move out of that. But they stood up from the session without pain, and we hadn't moved at all. Yep. And so when we think about the body keeps a score and the mental emotional and the trauma, it is deep in our body. And if we don't use, this is why somatics is such a beautiful methodology. If we don't use the body in the way that it's like, that it can be harnessed to metabolize and get stress out of it, then we leave a lot lingering in the body. It's what's his name? Resma Menenica, who does my grandmother's hands. He's the therapist who also trains in DEI for the Minneapolis Police Department. He's got his book, My Grandmother's Hands. It's about racialized and generational trauma, particularly for Black bodies. And there's this one chapter in his book, which is just like fascinating. He talks about clean pain versus dirty pain. Clean, and you guys are going to love this if you have not read this piece. Clean pain being when we approach discomfort cleanly. So we're not blaming, avoiding, distracting, being busy. We are accepting the emotion as it comes and holding it within our body. So we think about a clean cut versus a dirty cut. Clean cuts are going to heal faster every single time. Dirty pain approach, would be, this is uncomfortable and I'm going to move away from it, which is what my client was doing. This is uncomfortable. I'm going to move away from it. And I'm going to just keep doing these physical practices. And so if we're doing, a dirty pain approach to this, it's stuck and it's not going to clean as well. It's not going to heal as well. So this is a methodology that, he has his own practice into it, and I've just adapted it for what seems to work in my body and then applied that to clients that I'm working with. But it really kind of strikes down into that trauma, that pain, that grief. It's deep in there, and we have to have tools to be able to get it out. And I think I don't know what your opinions are, but my opinion is the body's 80%. So I better use that tool if I'm going to work with something mentally emotional.
Well, what I love so much about, I love so many things about, I love the clean and the dirty, and I read that book and I thought it was fantastic. But what it sounds like is that one of the coping strategies that you use to manage the anxiety or whatever vigilance may or may not have come up when you were out of nowhere, had several experiences of excruciating and debilitating pain, is that you have tools now. You feel empowered to use those tools that you know are helpful. And so you don't have to lay in wait for another horrible thing to happen, because you don't feel maybe as blindsided as you were the first time, because you did all of that research and you have amazing tools.
Right, exactly. And that's the reality that people cope with pain, is that it might come up again. Right. And just to have that worry and the stress and the anxiety attached to that. And so while, I wish anyone the best who wants to work with a practitioner who's going to fix quick, or, who's doing this or that maybe I don't agree with, I do want people to know that I made a lot of mistakes in my recovery. I did some things that I thought were safe. I thought I found the right doctors, and it turns out that I had problems that came up, 2 to 3, 4 years later that I had to completely undo. Now I had the tools to do it, but it did take some time. So there, that fear of wondering if it can happen again. And there's so many things that you're doing with chronic, but you're changing your healthcare plans, thinking about if something really bad came up, am I going to put big deposit down for my premium, or am I going to, what am I going to do? So luckily I don't have to, I get to have my premiums really, really low, because I know I don't need to go at all. So yeah, I've been able to transcend that for sure.
It's just fascinating to me. I imagine when you broke was it your leg? Do you have panic? Do you have a moment of uh-oh, the shoe has dropped and I have to go through this again and I have to reformulate, and there is something out of your control because you can't just kind of, imagine that healing on its own.
The break was different, given that I had some different things going on that my therapy couldn't. I had a lot of bone marrow edema, so swelling in my bone, and I, it's been a long recovery. It's been over a year, and there's still just a little bit of mobility that's there. But most of my thought process is I'm going to swear, tell if I'm going to be stopped by breaking my leg. And when I had chronic pain and I got through that, of course I'm going to find a way through this. But
I love that. Yeah. Another great coping strategy. I'm a warrior. I figured it out before. I'll do it again.
I don't really like limitations personally.
Well, and it's interesting. I'm going to bring something totally peripherally into this, and I'm going to talk about COVID. We have this.
Oh, yeah.
I am curious what comes up for you when I say that.
Well, of course, this might get political for other people, but sorry. So I have had my health taken away from me.
Yeah.
And I approached that pandemic as I'm not risking this again. Yeah, I know what that's like.
I knew you were going to answer that way.
Yeah, I'm not risking this again. This is all I have.
Yeah.
This is all I have. And I know that, there's this belief that we move into pain and discomfort as we get older, and this is just part of it. Yes, there is a natural, changing of the body as we age, but really, it doesn't have to be like that. And
your mom and I call bullshit.
Yeah, it does. Yeah. Did I say that her back is better at 60 than it was at her 30s? I already said it. Okay.
I love it.
But I want to go back to this, because you're right. I think COVID kind of brought trauma to our entire world.
Oh, yeah.
None of us at the beginning knew, if we get it, we wouldn't be one of the unlucky ones that dies, right? And so for someone who's dealing with health issues historically, and I work a lot with compromised terminal and chronic health issues in my practice, but everyone was on edge.
Yeah. I mean, there were so many layers to that as well, but
there were layers.
Especially with the health, with the long COVID and such, there's some fantastic practitioners. I'm just going to call her out just in case someone knows someone long COVID and still struggling. Robin Rothenberg, who is a yoga therapist, is doing just brilliant work with people with long COVID.
Oh, that's amazing.
It's doing really simple practices that include breathing. It's managing energy. She came out in 2020. She had a book that came out that's called Restoring Prana, I think. And it's a blend of like ancient yoga therapy. So not this like deep breathing is good for you. Like make a deep breath. Like this is really yogic. Like, no, actually you should be breathing. That's just like a sipping air in and sipping air out that won't disturb a feather. Like what the like ancient yoga texts say about how to breathe is not really how it's been interpreted in current culture. And then she marries that with like the newest science around breath work. And so being able to put those two together has been really interesting. So she's got a lot of long COVID resources.
Wow. Which are still being formulated and developed. Right?
Yes, it's cutting edge. I mean, I feel like I have so many people that would really benefit from that.
Yeah.
Question for you, and I'm assuming that your pain journey changed the trajectory of your career path and what you decided to do with your education. And it sounds like your vocation in the rest of your life. Yeah. Can you tell us, like, when did you make that pivot?
Yeah. So, so this is what I do now. I was in a corporate role before, and it was pretty much so I had about a year and a half of time after my accident until the first level of yoga therapy training that I took happened. So I had about a year and a half to take care of my pain with whatever resources I had that they offered, mostly working with someone and doing my home practice. And essentially, as soon as I joined the therapy program, I knew that this was what I was going to do. So it did change everything. I mean, there are 3 different levels of yoga therapy training. I finished all of them a handful of years ago. And it's different to be, as I've talked about with yoga therapy, some people don't really seem to understand the breadth and depth of the training that we have. And the tools that we have. But yeah, it has changed everything. What was sort of interesting is I had someone really wise tell me a handful of years ago when I was dealing with some major burnout. I had like a mental breakdown sort of attached to it. And they had said, well, there's something that's connecting the burnout and the chronic pain. And you need to find out what that is. And what was really interesting is that it was my approach to going all the time. This consistent reliance on being productive, being busy all the time. And I had friends saying like, I don't know anyone who's busier than you. I'm like, that can't be true.
Doug, are you listening? We need to take copious notes.
But when we think about it, when I would do like Pilates or something back in the day, I was young, like I would skip all the breathing stuff and the waiting and the pausing. I was just so go. And when we think about that, as far as like a muscular contraction, I've given no space for my muscles to fully release. So even if we apply this to working out, it's rep. There's no slowness, intentionality around the release. And if you keep contracting that muscle, you are going to restrict the range of motion. So it has changed everything. It's changed how I work out, what I work out with. It hasn't changed my nutrition around chronic pain, but because my training also includes Ayurveda, which is yoga's sister science, and includes nutrition, exercise, lifestyle, sleep, stress management. I think my family would probably say that while at core I am probably the same person, I don't think I look like this. I'm not the same person as I was pre-chronic pain.
Well, you are glowing, so I will sign up for whatever it is I'll drink what she's having.
Tea.
I really want to know, you referenced it before, I want to know how you manage naysayers.
About what I do or about pain?
Like the legitimacy of your work.
There's fire around that question.
I know,
I feel it.
By the way,
been a
people doubt
process.
therapy too, even though it's incredibly helpful and we know it works. Go ahead, please.
The joys. It's been a process of managing anger. So I think you guys definitely know this. We've got our fight, and freeze stress responses.
Sure do.
I'm a Pitta and Ayurveda, so I move into anger all the time. That is my emotion go-to. And so
no wonder we're getting along.
There's been a lot of normalization of having a relationship with my anger and understanding that it doesn't make me bad. It doesn't put me into that drama triangle persecutor mode, which a lot of people throw me into because, as people are probably noticing from listening to me, I am pretty bold and unapologetic. My fiery heart comes out when I speak, and I know that there's a lot of, my
Doug's writing that down.
heart.
That's going to be the name of his memoir.
And I know that we're going to have people listening to me who are thinking that I'm dissing on the professions, and that's not the intention. But the reality is I get angry about this because there is something that I'm passionate about, because I know how much this changes people's lives. And I know that my life was saved because of this. And so when I think about people who are naysayers, it's been a progression of first being really, really mad. And now I'm at a place where it's just like, okay, fine, don't have any magic. Whatever. It's your fine.
Suit yourself.
Fine, suit yourself.
Your loss.
Limp away the rest of your life. I don't care.
Well, in a much nicer way, much more compassionate way, right?
Yeah, Talia.
Thank
God, there's some compassion on this panel.
Well, and while we're having, giggles about it, we also know that as practitioners that we meet our clients where we at, and we meet and we extend that courtesy to others that we meet in our life. So yes, it really frustrates me and disappoints me on a lot of levels. I can't tell you how many times people are like, I'm seeing a PT, but it's not really helping. I'm going to stick with it, but can you just give me like a thing or two? I'm like, why? Like, why give them money? Have you seen them more than 4 times? Like, ethically, I don't think as a practitioner, you should see someone more than 6 times. And if they're not actually getting better, you should refer them out. It's not ethical.
Unless you're talking about
Unless
therapy.
you're talking about you guys. I'm not talking about you guys. I'm talking specific.
I'm on a 50-year plan for wellness with all my patients.
I'll tell you, I am aware of how difficult of patient I am. If I don't feel, you can laugh. I see you covering your face with the tea.
I got my teacup.
I think that's called drinking.
It is. I think, I'm aware that PT, I've had shoulder surgeries due to really bad jujitsu accidents. And I don't do well with PT because I'm impatient. So I need progress. Like, I think just moving this way and paying hundreds of dollars, I'm not doing this again. And it was interesting. My person who is my orthopedic surgeon is so amazing with me. He basically now knows if I get injured, he's like, I know you're going to keep fighting, so I'll see you next time you have an injury. I'm like, thank you for knowing that. And he also said, you know your body better than anyone else. Yeah. So he was really very affirming of me kind of paying attention to myself and knowing what I could and could not do. But boy, do I know that my childhood and my background has everything to do why I resist help. And so, boy, the psychology of this is what I really want to just keep reiterating, is that everybody has to know themselves emotionally and physically to kind of be able to do this work too.
Yes.
And the directness by which you do this, which I am a supporter of direct, as anybody who's watched the We're
number
Not Fine
one
podcast.
supporter.
Number one supporter. If I don't like the agenda, I don't follow it. I don't
Even
know if you
if
noticed
he
that
made
today. I can change my mind. And I've been known to have a fiery heart. I learned that that's what it is today. So
written by Doug Jensen. Oh my gosh.
I get you a t-shirt with that.
I know, I love it.
T-shirt fiery heart Doug.
Absolutely. We need that for our
I'll
merch.
get one for me. So you guys have iterated quite a few times that you see folks and they'll have chronic pain.
Yes.
And so I'm really curious, because I love hearing about what other practitioners are thinking when they're working with someone in chronic pain or they meet someone. What is it that you are, what do you do with that?
Gabapentin.
Okay.
You prescribe?
Kidding. I don't.
Doug's side hustle.
Marijuana. No, I'm going to go be serious for a second. I do work, and my background is in HIV. And so infectious disease docs and I work very closely together. And there are some incredible doctors that we have in Minnesota that are so good at collaborating and understand how important it is to collaborate, exactly what you said before. So I'm really fortunate to have those people that I can call on if I have a question about the physical part or whatnot. But I will tell you, this is why this conversation has been so important to me today. I don't believe my clients are heard about their pain. And I think because of HIV being a socially stigmatized disease, having neuropathy and having pain in your feet that you walk every single fucking day, people have a hard time feeling entitled because of people like Ronald Reagan, who said it was a sinful disease and there was going to be no research for it decades ago.
Yeah.
So all of the shame and internalized stuff about this stuff makes people have a hard time advocating for themselves. So I think this is critically important to have that conversation. And of course, as a therapist, I'm like, nope, let's fucking speak up. And if you can't, I'm going to call your doctor on your behalf. So there has to be relief. This is where I'm so excited about this conversation because I do not think people should live this way.
No.
Thank you for agreeing.
Thank you for agreeing.
And I don't have chronic pain, by the way. So I feel really fortunate. I'm grateful
You
at
are.
my age,
I'm
like your
knocking
mother's
on
age.
wood.
I feel really grateful to feel very fit and feel really able, and there's no limitations at this point.
Yeah.
So I try to empathize as best I can, but I also recognize how incredibly difficult it would be for me because I'm a baby. Like I would not handle pain. You can laugh.
We'll see what this
I have a
conversation.
fiery heart, but I'm a baby. So if I got injured,
Oh my God. That's the prologue.
that's the whole T-shirt. I have a fiery heart, but internally I'm a baby.
But I'm a big baby.
I just don't think I'd handle it well. So I'm impressed with your strength
Thanks.
and fortitude.
Endurance.
Yeah.
I feel like maybe the way I would answer that is I think about like that mind-body connection. And I also agree everything is so siloed. And I don't feel like necessarily seeing a therapist is what you need to do to manage chronic pain. I will always make sure that the person has a provider that is in the health world and the pain world. Although I don't have any go-to people, I just sort of maybe have hope in the universe that if they find a provider or a primary care person, that primary care person will find that client the path that they need to be on, which is maybe a false hope. So the way I handle it as a therapist is I want them to advocate for themselves on that medical journey, but I think about the mood and the fear and the anxiety and the hopelessness and how it's impacting the relationships and how confident they are in their own tools. Is it a victimhood or an empowerment? What's the narrative? How much headspace is this pain taking up in their lives?
Can I also add that while we all three believe that people should do the best they can, and if you are unable to do it, acknowledge your limitation and figure out a way around it. I have a number of medical professionals on my caseload. I have a number of medical professionals in my life. And the world that we're making them work in is impossible.
Like there's no soul in it.
There's no soul.
Not enough
There's
time.
documentation there. You know, the software circumstance. I remember my doctor looking at this checklist and he's like, I can't fucking find what I'm needing to check here. And so the limitations, and that's why I love that you have freedom. I personally don't take insurance as well. And I'm grateful and I'm really very humbled by not needing to take insurance. I can't work with them. I think when I have high schoolers call up and say, I'll give you 10 visits because that person is managing an HIV condition, I am the worst person on the other end of that phone.
Or the best advocate.
I'm the best advocate.
Fiery heart.
I've had my license threatened a couple times, and then I threatened theirs. So that works pretty well.
He must also be a pitta.
Yes.
So I have an Ayurvedic medicine friend.
Yeah.
And she, when I eat food, she'll say, oh, don't eat that. I'm like, oh, okay. Can I order something else? Like,
and Doug loves it when people are authority figures and tell him what to do and what not to do. It's his fave.
I think that's sarcastic. And I think you're right. So, but I love your question. Like, what do we do with it?
Yeah.
I do feel a level of helplessness. I sit there sometimes and I'm like, you should not have to hobble into my office every week. Like I have a client who literally hobbles sometimes and you can tell he's in such pain.
Yeah.
And he's had HIV now for 30 years.
Oh my God.
It's so painful.
Plan on a referral.
Okay. Please
Rhianna, I'm embarrassed to even ask this because I feel like what you just said is you'll have people that are like, I'm going to keep doing all the things I'm doing that aren't working. But could you give me like 2 things, tips and tricks? So I'm going to shield my face while I ask, is there anything
that you can do that's not working with me? Is that the question?
No.
Oh, okay.
The question is for our listeners and our viewers, is there anything under the umbrella of somatic yoga therapy that you could share with us that we might even be able to, like an exercise that might be generalizably useful?
Why are you shielding your face?
Well, because I'm basically saying, like, can you give me one tip and trick, even though
Like for
we're
free?
still doing, like, I'm still doing the other stuff. I'm still in PT in Cairo. But can you give us one exercise?
Do we have time for me to go a couple minutes into it?
Yes.
Okay. All right.
Time is not being monitored by anyone.
Not being monitored.
It is being monitored by me. Thank you. And you're welcome.
All right. So a couple disclaimers about this. There's going to be a little bit of education in this, and then a couple disclaimers. So if you are in chronic pain, please do not try this and think that you are going to get better. I just have to legally cover myself. Please go talk to your doctor and ask about what you should do. But
What's
I'm
your
going
phone
to...
number?
I'm
kidding.
Now I'm going to drop back down into being an advocate and having a personal story and borrowing a little bit of my professional tools. So this is brain science that we're doing, or pain neuroscience. And while I think if you've got chronic pain or tension in your shoulders and neck, you can certainly try this. But I'm going to give a level of caution. You need to work with a practitioner that understands your body. Back pain is my bread and butter. I have never given a person the exact same thing to do with back pain because it's different based on how you move, how you lived, all this stuff. So this practice would probably be better for folks who have less than 5 out of 10 pain and aren't really chronic, but maybe have more tension and discomfort. So this is the safety net for this. If you have chronic pain, by all means, I'd rather you just like book a chat with me. I'll just talk to you about it instead.
Fair.
So we're going to do kind of the upper shoulders and trap area because it's where a lot of people hold stress, and it's the easiest one to do as we're sitting.
Oh, this is so good.
So a couple things to know. We're going to go into a chronic contraction with these muscles, and we're going to release them super slowly. When I mean slow, I mean like stupid slow.
Stupid slow.
Stupid slow.
Do you hear
Like
that, Doug?
sap dripping off a tree slow.
Oh.
Like
Okay.
really, really slow.
Okay.
The reason we're doing this is because what happens when we do a movement pattern on repeat is it moves out of our prefrontal cortex, which is like our pilot, and it drops down into the subcortex, so autopilot. Autopilot's job is not to respond to new stimuli. So sorry, but I'm just going to call these professions out. That's why chiro and massage therapy typically will not make a big change, and why people go back so regularly is because there's adjustment, you come back to center. Adjustment, you just come back to maintain the course. You can't change that unless the brain is involved. So we need to get the pilot back on. The only way you do that is by giving the brain something new to pay attention to. And with a muscle that only really does 2 things, it contracts and it gets longer, lengthens, and you contract it just a little bit more to a safety point, just a little bit more. The brain senses that something new has happened. Oh, I've contracted further than before. Okay, this is new. I'm going to pay attention. And then we keep the brain engaged as we slowly release that the brain says, oh, I forgot we could do this. There is more lengthening to be happening. This is new to me.
Oh.
Then we do the practice with them more consistently so that the brain starts to have that neuroplasticity and makes that change. Be like, oh, okay, I remember now, until we get to the point where that then becomes the normal. So this just gives you a little bit of understanding of why this has got to be slow and we got to be thoughtful about it. You cannot do this watching TV. You cannot do this doing this listening to music. It won't work because your brain has to be engaged. So you're going to pick a shoulder. I don't carry any shoulder, and you all can do this.
Okay.
So you're going to take a finger or two, and you're going to tap on the neck, the upper shoulder, the upper kind of trap area. What we're looking for is not a caress, and we're not looking for a deep pressure trigger. I'm looking for a little bit of an awkward tap so that your brain is like, oh, it's like someone like rapping on your door annoyingly, like,
I'm
hello,
annoyed with myself
hello.
for tapping myself.
Yes, I'm sure. Yeah, you are going to get
I
agitated
am
by the
agitated
tapping. Yes,
already.
you're going to get
Yep.
agitated from the tapping. I know, but you're going to work with it. Just for a
She
little
has
bit.
faith in
I'm
you.
agitated as you telling me what to do.
Fiery-hearted big
Just
baby,
try it.
you could do
Just
this.
try it, Doug. Just try it.
Oh my God.
So anyways, we're paying attention, we're tapping, and now we're going to remove our hand, and you're going to notice that you might actually feel more of a connection to this shoulder than the other ones. Like you're a little bit more aware, you can kind of feel the echo of the tap. Yeah, that's what we're hoping for.
I feel like I know it.
Yeah. So now what we're going to do is we're going to move this shoulder up really, really slowly to our ear, and we're going to feel those muscles contract. Now, if this causes pain, don't go any further, but we're going to go, we never go past the line of pain. We just kind of go into the contraction in a comfortable, like a safe space. And then we're going to hold the contraction and think about these muscles being tightened because we're bringing our brain to this area that we want to re-educate. Now, really slowly, like hard taffy getting soft, we're going to let the shoulder, just the one, come down stupid slow.
Don't forget about the stupid part.
Yeah. And we're thinking about those muscles getting longer. Maybe we envision them. And you need to control all the way to the end, as if you're putting down like a baby that's been screaming for 10 hours down and it's finally quiet and you don't want to move it. And then you will release. And we're going to do one more and see if we notice a difference. So again, we're going to bring it up. And we'll all be quiet as we concentrate on slowly releasing this. We're breathing, our jaws relaxed to help with that too. Controlling all the way to the end. As smooth as we can make it. We might notice some bumpy, jittery movement. That's okay. That just means you have sensory motor amnesia, and we need to keep doing this. So now we're gonna use the brain to apply to see if we can notice a difference. So do we notice a difference from one shoulder to the other? Does it feel softer, lighter, more easeful? Do I feel like I have a stronger connection to it? Does it feel like its alignment is maybe different than the other one? For me, I already feel it. Now, 2 passes is not a lot. Usually 3 to 5 is kind of a sweet spot, depending on the person. But that's essentially a practice. And now you can do this sitting, you can do it lying down, you can do it in line, you can do it while you're on a plane.
What I noticed and what really spoke to me is how I don't think 99.999% of the time I have any awareness of the autopilot that my body is in terms of posture or tight shoulders or clenching my jaw. And so even just like bringing that awareness to just feel like maybe that's autopilot and bringing in intentionality and that slow release, like there is some power in that.
The interoception is a big, big piece of this as well. You know, and so the next thing that happens is, okay, so, you know, someone has shoulder pain, neck pain, whatever. This might be one of the practices that they get out of pain, you know, pretty much every time. It decreases the levels, all of that good stuff. But it like never goes away or something, or it like never goes down to 0 or something like that. Well, then one of the things that I do when I'm working with someone is I'm really paying attention to how they're moving. And so perhaps every time they get a glass of water, they go like this and they just recontracted it. So or maybe when they brush, maybe when they brush their teeth, they go like this. Or maybe when they shake someone's hand, like how many times are you contracting it? Of course it's going into that contraction and it's getting tight and it's forgetting to release. So there is a re-education in how we are moving throughout our life in order to help progress us well.
So weird question. And of course, people who are not viewing us on the tube are not able to see what you just did, but I am curious how this applies to a back.
Yeah.
Like, do you poke your back?
No, not usually.
Okay.
I mean, you can reach around. Like if a client, if it doesn't cause discomfort, I will ask a client, like if you'd like, and you don't think it would increase your pain, like see if you can tap, or if I'm in a session with them, I will ask them in a way to make sure that they know that they have complete autonomy to say no.
Yep.
And I can say, you can do this without me doing this. If you'd like me to try, I can. And I'll just tap a little bit on the back to bring that brain's awareness to where we're trying to move into a contraction.
That's pretty powerful.
Release. Yep.
What I hear you saying that I feel like has been the theme throughout is you want people to be an active participant, even as a pain sufferer, like not to be a victim sitting back and waiting for somebody else to help solve this, but to start to be trying to have a better connection with your own body, like mind, body, soul. We're in charge of that. We can't sit back and wait. We need to be intentional and noticing and bringing awareness.
It's empowerment.
Rhianna, you are amazing.
Thanks.
And
really
I want to ask, before we open the floor for questions, how can people find you?
So I do have an Instagram. It's called The Relief Space. And then I've got a website, thereliefspace.com. I'm currently housed for clients who want to come and see me in person in Bloomington at the AHI Integrative Health and Wellness Clinic with a group of other practitioners. But really, I mean, what I would love for people to do if they're in pain or if they know someone in pain is just to book a free chat with me. It's like, this is my gift back to my community where I want you to tell me your whole story. You have 60 minutes. I've been on the phone for 2 hours with someone.
Wow, that is a gift.
Yeah, because there's a lot that goes on in this process. So I want you to be able to tell me your whole story, whether you choose to work with me or not. We'll talk about it. I'll give you answers. I'll hold space for you. And usually you're going to walk away with answers that you've been searching for a really long time and hopefully feel relief and a hope for relief, regardless of if you choose to work with me or not.
Does anyone have any questions for Rhianna or thoughts or comments or?
I was just wondering, is your practice kind of integrated with the recovery process from an accident and things like that in like mainstream physical therapy?
It's not, unfortunately, which is a sadness to me. No.
Because I know there was talk of go and talk to your service provider and things like that, and I've been down that road a couple times, and before the epidemic there was just give you drugs and then covered up, and then and that's a miserable way to go because it really doesn't do anything. And then after that, now there's no pain care, so they cut you off like probably before you need to be cut off with some of that. And then there's no other options besides physical therapy.
Right. Yeah, no, sadly, there are less than 100 people who are trained like me. And even within this space, I'm a rarity to have experienced so much chronic pain. And so it means that the job of advocating for this type of work really falls on me and others to keep doing this. And so sadly, no, most practitioners are not aware that a better option from an accident type of injury really would be to come see someone like me. It's faster, quicker, and it's going to serve you in the long run. Like I said, where you can apply the exact same methodology to something else. So if you ever had another accident or you just tweak something, you would know exactly what to do. Yeah.
Well, I was just wondering for information because this is the first time I've heard of it, and I could have really, really used this. It was real detrimental to my marriage and my life in general to go through that process.
Yeah.
And Jeff, you referenced something that's really, I know very personal. I know your story obviously as your friend. But I think the use of opioids that are very addictive in those circumstances and getting cut off and not having any sort of management well done about that as well.
Well, the first time I had to cut myself off.
Right.
And because basically we weren't doing any good anyways. And, through a lot of, mental work myself, I had no options besides to do it myself. It was,
right.
It's awful.
And then the second time it was like, well, here's a week's worth of pain medications and we'll see you later.
Which is
it's
really
so
dangerous.
negligent.
Yeah. Very dangerous.
Yeah. Well, now you know.
Now it's not
now
too
you know.
Yeah.
And I wish there were more options available to those of us, because it sounds like you had the same feelings as I did of like, these are not the options that I want. Yeah.
Thank you, Jeff.
And when you're in pain, you go with what's easiest and what's being told to give to you. And pain, those pills do mask it for a moment, right?
Well, and also I feel like when we're really struggling and in survival mode, we don't have a huge capacity to do research on alternative medicine that we might never have heard of, or what are people saying about this? You're just like, what's my next move?
Yep.
Right.
But does anyone else have any questions or thoughts? Or
I'm curious, a lot of the discussion tonight's been about pain specifically, but I'm wondering how this modality works, or if it does, and how it works with other illnesses outside of acute pain, muscle spasm, contraction issues, if it's like, can be applied to chronic illness of
fibromyalgia, all of them.
Yeah.
Yes.
Different
Great
things
question.
like that.
Yeah.
So,
Fantastic question. Yes, it can. I am currently working with someone with fibromyalgia. So particularly with women I'm not an expert, but what I have sort of deduced with fibromyalgia is there's a physical component to it, and then there's also a mental emotional component to it. So that's where the clean pain, dirty pain, and being able to use your body to metabolize stress has been really helpful to get someone out of stress, and then also you work on that mental emotional layer as well. Some of my colleagues work with Parkinson's, MS. I've worked with restless leg syndrome. I don't know many people who are working with like dementia, but there
that's
are. So
fascinating.
the interesting thing is most of us who come out of this therapy usually take it and apply it to an area of our life. So I've created like work for my friends who are pregnant, from essentially getting pregnant all the way through 9 months after birth, and just based on a woman's body with all the different, you're pregnant and you're arched, and then you're holding your baby or you're feeding it and you're curled, and now I'm in a curl contraction where I'm tied on both sides, and then you shift it to your hip and it's there. So this absolutely can be used in things outside of physical body. I also think yoga therapy is really unique in that it's very holistic, where we are working on and your energy level, mental, emotional, sense of intuition, and connection to whether it's religion or universe or higher self, that as well. And yoga therapy is really, really beautifully able to move between these things. I don't even know that I'm doing it anymore because it's just so innate. And I think that yoga therapy in general is really about eliminating suffering wherever that might be. So I know a lot of when I have someone who asks me a question about a type of condition that I don't specialize in, I have so many wonderful people who are trained like me that I can
That's
share.
great. A wealth of resources.
Yeah, there's not a lot of us, but there's enough.
Well, I was going to say there's not a lot of you, and so kind of mutually supporting each other to learn more about these other diagnoses and consult and keep learning. I think it's critically important. I want to go back to something that Jeff said that was really important, and we kind of scattered over, was your marriage, right? Like this whole podcast is about mental health and relationships, and so what it means to have chronic pain impact your relationships, not only using any sort of prescribed opioid or addictive medication, which I know you were referring to. It really does impact your functioning on a daily basis and your presence for that relationship. So I really want to just reiterate kind of why we're having this conversation in many ways, aside from learning a new technique and skill, which again feels miraculous, I'm going to say, and I'm so grateful for your strength as a fiery heart person. But it really does help everyone to have some hope, and I hope that partners of people who have chronic pain are listening to this as well.
Yeah, it was a really close friend who introduced me to this, and so my ask is always, if you know someone in chronic pain, they are likely not talking to you about it much. Maybe a bit, but not much.
Who wants to talk about it all the time?
Exactly,
it's draining.
Ever.
It's draining.
Right.
And, the biggest kindness and compassion that you can do for them is to be kind and compassionate, but also, help them with that mental load and share resources for them, if you can.
Beautiful. A great tip for the love and supportive people next to the sufferer. This feels like a perfect segue to say we are so incredibly grateful to each and every one of you for showing up and being a part of our live recording. And this is why we do what we do. Exactly what Doug says. Like, it's the mental health and the relationships and all the different pieces that impact those things. It feels like all there is. It feels like the most important things in the world.
Thank you to our team. Thank you to Rogue Buddha Studio and Nick Harper.
Jeff, Crandall, John. Where's John? Olkey.
In the back.
There he is.
Yep.
And do you want to tell peeps how they can find us?
I don't actually know all that much about that. But
Doug's
we're not fine.com. Everyone knows my address by this point. We're not fine.com. You can submit any questions. We encourage people anonymously or give your name. We really want people to find us and let us know what you want to talk about. Talia and I recently kind of talked about having a town meeting, so we'd love feedback on how people are experiencing this podcast.
Yeah.
I can tell you, Rhianna, like, this is so meaningful for so many people. And I think there's an emotional piece that we take for granted when we've done this for a while, that this is an important conversation that really has a very impactful place. So we'd love to hear from you on We're Not Fine. I know we're on Instacart.
Yes, Instacart. So
Whatever that is.
Instagram, it's Dr. Talia Jackson and Douglas L. Jensen with an EN, and also We're Not Fine Pod. I think we have a young, adorable social media person that puts out TikTok videos. I don't think Doug and I know how to access them.
You said something about you liked her video. I don't know what that was.
It was so good.
Where was
I can't find it again. TikTok. We're also on YouTube. Every single one of our episodes is not only on all of the platforms, Apple, Spotify, all the things, but you can actually watch us on YouTube.
Which I loved the feedback from people that actually seeing who's talking helps a lot.
It does. Putting a voice to a face.
Right? And I will say that
to a
this
voice.
setting is so beautiful
Yes.
for us to
Thank you,
videotape
Nick.
this in. Thank you, Nick. All of this is gorgeous. Thank you for hosting us every week.
Thanks, everybody.